Yali Madad. Good afternoon and welcome to this webinar hosted by the Smiley Health Professionals Association for the USA. The objective of this webinar is to provide up-to-date medical information to our audience pertaining to coronavirus, also known as COVID-19. As we all know, this is a rapidly evolving situation which we are closely monitoring. What we would like to achieve by the end of this webinar today is for each individual and the family to know about this infection, how they can prepare for it, and how they can make informed decisions to help safeguard their health, the health of their families, and the community. It is truly our honor to have with us two excellent panelists on today's webinar who bring decades of experience in working with infectious diseases, both from a clinical standpoint as well as from an epidemiologic and public health perspective. Our first panelist is Dr. Umaid Ajani, who is a physician epidemiologist. Dr. Ajani was previously an epidemiologist and a teaching faculty at Harvard Medical School and the University of North Texas Health Science Center. He has previously participated in the H1N1 response in the US, Ebola response in Africa, among other various response teams that he has been part of. Our second panelist is Dr. Malika Kiraj. Dr. Kiraj is an associate infectious disease consultant and assistant chief of the Department of Medicine at Kaiser in Redwood, California. And I'm Salim Varani. I serve as a professor in the section of cardiology and cardiovascular research at Baylor College of Medicine in Houston, Texas. Let's go to the next slide, please. I would just like to point out for this group that we are going to have a repeat of this webinar predominantly in Urdu on Tuesday, March 17th at 8:30 p.m. Central. Again, this is going to be predominantly in Urdu. So if you have family and friends who would like to attend that webinar, please let them register for this webinar at akhb.thesmileyusa.org as well as the.smileyusa. Both of these websites should have these links ready in a few hours, as well as those of you who subscribe to Smiley Insight should have gotten an email which has the links that you can use to register for this webinar. Next slide, please. So the way we have this webinar structured is that we have some common questions that we have been getting from our audience. So we have those questions prepared, which we will post to our panelists, and they will answer those questions for us. And then towards the end, we will take questions from our audience. As you will all notice, there's a box on your right-hand side of the screen that says questions. Please type in your questions, which we will address towards the end of this webinar. So let's go to the next slide, please. So we'll start with our webinar now and start with some common questions that anybody would like to know. So the first question is for Dr. Kiraj. Dr. Kiraj, can you tell us what are coronaviruses and then what is a novel coronavirus or COVID-19?
So coronaviruses are a group of viruses that has been around and typically cause mild respiratory infections like a common cold to severe lung diseases like severe pneumonia with SARS and MERS in human beings. It looks like a ball with spikes coming out of it. Depending on the type of the virus, it can attaches either to our nose or to our lungs. The usual common ones that we see attaches to our nose and give us the usual common cold. But this new coronavirus known as COVID-19 has the potential to attach to the cells in our lungs. Once it attaches to the lungs, it can multiply there and cause pneumonia, which in turn cause difficulty breathing and other issues. The new coronavirus is supposed to have come from animals. In Wuhan, China, they were selling live animals, and which then crossed into the humans from the bats. And then once the humans were infected, it was found that people who were close to these patients who were infected with this virus were also getting the infection. So now we know that this infection can be transferred from humans to humans.
Thank you, Dr. Kiraj, for that summary. So for our audience, this coronavirus belongs to the same family as the prior SARS virus or the MERS virus, which are different from flu virus, which we'll discuss in a minute. Of course, initially, these viruses are found in animals. The virus made a jump from an animal to a human, and now we are having spread amongst humans. So can you tell us how does it spread from a person to person?
So basically, because it affects the nose and the lungs mainly, it is spread through the droplets from someone who's coughing or sneezing and between the people who are in close contact with one another within about 6 feet. And through these respiratory droplets produced when an infected person coughs or sneezes. These droplets can then land in the mouth or noses of people who are close by and then can possibly be inhaled into their lungs. The other way it can spread is through contact by touching the surfaces of the people who are close to that and coughing, and those droplets land on the surfaces like countertops, uh, the doorknobs that they may touch after coughing or sneezing. That is how you can get it.
I see. So if I were to summarize, the two most common methods are droplets as well as via the use of infected surfaces. Okay, that's
Yes.
good information. So the next question, next slide, please. That's for Dr. Ajani. Dr. Ajani, given your background in epidemiology, can you tell us what is the difference between an outbreak, epidemic, and a pandemic? Because we're hearing now that COVID-19 infection is now declared a pandemic. So can you explain to us and give some examples as to what are the differences between?
Sure, Dr. Rani. So these terms are quite frequently used in disease situation or in epidemiology. The outbreak is usually referred to as a situation where more than expected number of cases or perhaps a number of cases clustered together are identified in a limited geographic area. And usually these come from a single source. A clear example of that is perhaps a foodborne outbreak coming from a specific food item or from eating at a particular restaurant or a source. On the other hand, the epidemic is a larger scale. It basically involves an outbreak in multiple communities where several cases are identified, and these could be due to a single source or could even be multiple sources, which can also be self-propagated sources. The third term, pandemic, that we're starting to hear a lot more is used when the condition is pretty much global, when the infection has spread over multiple continents and there is some clear indication of spreading of infection or condition within several communities. As we know that COVID-19 infection has been reported in multiple continents as of now, in America, in Europe, as well as there has been clear evidence of community spreading. That's why the World Health Organization has now declared this particular condition or infection as pandemic, being a global condition.
So, of course, this was declared as a pandemic last week, Dr. Ajani. So the question is, what changes would a common man or a woman notice when something is declared as a pandemic?
So a couple of things I would say in terms of what changes. First, that if the infection or a spread is a smaller level, it is a simple outbreak or an epidemic, a lot of interventions are pretty much local and focused on the source, meaning identifying people who ate at a particular restaurant or they were consuming a particular food item. In terms of pandemic, the interventions that are applied pretty much expands from individual level to a larger community level. For example, now we're seeing how larger community actions are being put in place. closures of schools or closures of large sports activities, closures of all mass gatherings, places of worships. These are the interventions that are put in place in a pandemic with the clear intent of stopping the spread within that country and within the larger community per se. It also releases a lot of resources that could be the testing resources or intervention resources, and it frees up in terms of financial resources from several government agencies so that communities can implement those public health measures.
I see. So that's important to know. Thank you, Dr. Jani, for clarifying that. Let's go to the next slide, please. And this question is for Dr. Karaj. So Dr. Karaj, can you explain to our audience what are the common symptoms of COVID-19 infection?
So majority of the people who get infected with the virus may be asymptomatic or have very mild symptoms, just like a little cold, sore throat, body aches, feeling tired and weak, to having high fevers, cough, and shortness of breath or chest tightness. Uh, the disease appears to be potentially more severe in the elderly, the frail, those who have underlying health conditions like diabetes, COPD, or have active cancers going through chemotherapy.
I see. So if I had to summarize, mostly these symptoms include cough, fever, shortness of breath. There could also be some constitutional symptoms like feeling very tired or weak. And then, of course, the symptoms are much more severe in those who may have some other risk conditions that we will talk about. So the symptoms seem very similar to flu. Is that right?
Yes.
Okay.
It could
Let's
be.
go to the next slide, please. So I guess then the natural question is, and maybe Dr. Ajani, you can take this question, is COVID-19 the same as flu? Is it different? Is it worse than flu? What do we need to know about?
So COVID-19, this virus is a type of corona family of virus, which is the same type as previously identified in SARS and MERS. We heard Dr. Keraj describe this particular virus. It is certainly different from influenza virus, commonly known as causing the condition flu. People have heard about different strains of flu, whether it is type A, type B, but we are still learning a lot more about COVID-19 virus. Coming from different families, though, the initial symptoms of COVID-19 as well as flu are quite similar. We heard symptoms as cough or fever or some respiratory symptoms. These symptoms, though are similar, coming from COVID-19 or coronavirus, are reported to be more severe than the flu symptoms and also are much more deadlier. In other words, the death rate among people who get COVID-19 is higher than, or much higher rather, than those who get flu. One of the areas one can also think about is the availability of resources for these two viruses. And part of the reason could be that we do not have much of vaccines available or prevention in terms of vaccines for COVID-19 at this point, whereas the vaccine is available for various strains of flu virus.
And I guess the same holds true for medications as well. We don't have any medications available for treatment of COVID-19, whereas for regular influenza, we do.
So that's true, because for COVID-19, it's all supportive therapy at this point.
I see. Now, you mentioned that, of course, it is much more severe than regular flu, but can you point out to our audience as to what proportion of the population gets severe disease? Because, of course, not everybody gets severe disease, although it is much more severe than flu. Can you provide some numbers to our audience?
Sure. I mean, in terms of what has been reported in multiple countries and from various reliable sources, almost about 80% of people who get COVID-19 or coronavirus, they may end up having relatively less severe conditions or very mild symptoms, which may look like simply having some fever and cough or very mild symptoms. Though I should say that those are a little bit more severe than flu. The remaining 20% may get more complex or more severe conditions that may need hospitalization or more severe treatment values. And even within those, there is chances for getting it to the severity level where respiratory support may be required is 5% or less. So though wide majority of those who get infected do not get severe conditions, I do want to stress that the prevention of these infection is a very important step in avoiding the spread of condition.
So thank you for clarifying that. Now you mentioned something that was also mentioned by Dr. Kiraj, and we can go to the next slide. And what you both had mentioned was that there are some individuals who develop severe disease or are at a higher risk of having complications from COVID-19 infection. So can you tell our audience what group of patients are the ones who get a more severe illness? Who are those higher risk groups?
Sure. So although everyone is, the risk of getting infection is pretty overall. When we talk about higher risk for complications, there are few groups which are identified as high risk. So the risk of severe disease or complications are much higher in those who are older age group. And most experts now agree that anyone who is 60 years of age or older may end up having severe conditions or even complications from COVID-19 infection. The second group of people are those who already have chronic diseases. These include people with lung conditions. We have seen a number of people getting asthma or heart disease or diabetes. In other words, any chronic, long-term chronic conditions, these people are at increased risk of getting severe disease and or complications. And the third group we would say are the people whose immunity levels are suppressed. These could be due to conditions per se, like cancer, or those who have had some treatments that could include chemotherapy. These people are also at higher risk. So if you are at a higher risk due to these conditions, whether it's age or a condition, it is important for you to take actions, much more important for you to take these preventive actions to reduce the risk of getting sick, because if you do get sick, the risk of getting complications is much higher. And that's why it is also important for people with chronic disease to be constantly in touch with their the physicians if they suspect any infection.
I see. So what are some practical tips? For example, if I'm 70 years old and I have diabetes or heart disease, what can I do differently compared to an average person?
So there are a couple of things I would say in this matter. Number one, you yourself, if you are in this risk, have to take action in terms of, and we'll talk a lot about other strategies, for example, washing hands or avoiding crowds and mass gatherings, avoiding any circumstances which would put you at an increased risk of getting infection. So it is critically important. And when we talk about these risks, what are the prevention measures? You should especially pay attention to that. You also need to make sure that the others who are available, perhaps in your household, or if you have grandfather or grandparents, you who's not in the high risk group need to be careful in making sure that you make it possible for those at high risk to use these steps, meaning perhaps those who are not at higher risk can help people with higher risk to maintain their situation, helping them out getting stuff. If they need to get out for some reason, the family members can do that for them so that the elderly or high-risk group don't have to really go out of the house to get things done.
And the other thing here would be that if I am an older adult living alone, I think I should know who I am going to call if I need help, knowing my neighbors, who those folks are, having a month supply of medications for any chronic disease that I may have, and knowing who really I would call if I need help, and having a lower threshold for calling my PCP if I develop any of these symptoms.
Totally agree, but and I would also add one more step, that make sure that you stay in touch with your family. Let others know that you are at home and you are alone. So set up a plan. So maybe you have to have a one call a day, or 3 or 4 calls a day with your family members or your friends. So you stay in touch with them so they can also know that you are doing okay.
Perfect. Let's go to the next slide then. And this question is for Dr. Kiraj. So of course, the real question is, how can I protect my family and myself from this infection?
So basically, as I had mentioned, that it is spread through droplets and contact, we need to prevent those two areas. The recommendation is wash your hands often with soap and water for at least 20 seconds. Wash in between your fingers, through the web areas, the fingertips, around the thumb. You need to wash every place of your hand that could have been contaminated if there is virus floating around. If you don't have soap and water, you may use alcohol-based hand sanitizers as long as they are above 60% alcohol. Avoid touching your eyes, nose, or mouth with unwashed hands. Avoid close contact with people who are sick. As I mentioned, you need to keep 6 feet distance. In fact, those people who are sick should actually try to isolate themselves and not go out around other people. Cover your mouth and nose when you're coughing, or cough or sneeze in your elbows or under your shirt. Right? Now, the other contact precaution is to clean and disinfect objects and surfaces you touch. Clean with the disinfectants, the common touch points, as I had mentioned earlier. Try to do that often. And again, as Dr. Ajani and Dr. Virani mentioned, if you are in the high risk group, stay away from crowds. Try to isolate, stay home, don't go to groceries, see if someone else can help you out. I know it's hard to stay home, but if there are parties going on, I would recommend that you refrain from going into places where there are a lot of people.
I see. So again, very important that we maintain this. And I think one of the most important advice you gave was that if you're sick, stay home. There's no need to go out and spread any infection. It can be anything. It can even be regular flu. So the best service that you can provide for your community is stay home when you're sick so you don't infect others out in the community or at work. And then these common sense measures, whether it's how we cough in our sleeve rather than the palm of our hands, proper hand hygiene, as you went over, as well as cleaning all the surfaces that could then infect us. So that's very good. The next question, Dr. Kiraj, and we can go to the next slide, is that we talked about some of these common sense measures. How can we prepare at home so we don't get these infections?
So the main thing is, again, keep everything clean, the contact surfaces, wash your hands. And again, those who have chronic conditions, they need to have their medications, at least a month supply. Make sure you have your medications for a month. Contact your physicians. And on the other hand, as far as food and other basic necessities, the guidelines is to have those for at least 2 weeks worth at home.
Okay, that's important. Now, the other thing that there are questions that usually come in about kids. Of course, we know that kids generally do not get as severe symptoms. At least that's what it would seem like based on early experience as adults. But I guess it's important to recognize that kids can still transmit the infection to others. So making sure that our kids are also practicing these things that we're talking about, whether it is hand hygiene or the proper cough etiquette. So I think we should make sure that kids are also doing that. Is that right?
Absolutely.
Perfect. Let's go to the next question then. So we talked about what we can do at an individual level, what we can do at home. The next question is, what can we do at our workplaces to reduce the chances of either getting infection or transmitting it to other people? Dr. Jani, maybe you want to take that question.
Sure. So I would say basic principles of reducing the risk are same as what we just heard from Dr. Kiraj in terms of keeping our hands clean and avoiding crowds. But for work, I think if one has an option of teleworking or working from a remote site or from home, and I believe more and more employers are allowing telework policies. So if this telework policy is available, which can reduce the exposure to other people or crowds, it is certainly advisable to use that benefit. Now, if that is not an option, and if you have to go to workplace, you need to continue to keep your hands clean by frequent washing, avoid touching face, or keep the surfaces clean, especially at workplace where the surfaces are shared with so many other people. And also try to keep a distance from others, especially if you see somebody who's not well or who's sick. It is advisable to keep a distance of about 6 feet between two people, and that would at least help reduce the spread of condition from one person to the next. In essence, applying all these public health principles is important. And above all, if you don't feel well, make sure you inform your supervisor and employer and stay home, because by staying home, you're helping not only yourself getting better, but also avoiding infection spread within the community.
I see. That's an important point. Now, we of course have a good proportion of our community that works in convenience stores or C stores, and we have some questions coming related to that. So, can you provide some practical advice on those of us who work at C stores in terms of what steps we can take to reduce our chances of getting infection?
So basically what we need to do is take these principles and apply it to our own conditions. If you're working in C stores, it is quite clear that you will be interacting with a lot of customers. If that's the case, maintaining some distance, that will be a very good habit. You share a lot of common counter space, and to make sure that you keep that counter space clean by constantly wiping with regularly available disinfectants. You need to make sure that you keep your hands clean. If you have possibility of washing them frequently, that's great. If not, using sanitizer constantly to make sure that you keep your hands clean. There may be, and again, not necessarily in C stores, but there may be other work areas outside of counter where you may or may not be able to do that. If that's the case, perhaps using some gloves so that you are not exposed to that. Or if you have to get very close to other people, you may use other protective gears. We have seen people using masks. Now, again, we can certainly talk about its effectiveness, but depending on your situation, if that helps reduce the infection, one can use that. So there are a number of protective equipments available that you can use to make sure that these principles are applied of keeping the distance, keeping hands and surfaces clean to avoid any further spread.
And then the other high risk work condition is healthcare professionals. So, what can healthcare professionals do once they are back at home that they don't infect their other family members? Are there some practical tips?
For healthcare, again, if they are home, they basically still need to use the same principles. In their work environment, of course, healthcare professionals are constantly meeting with other patients, and the use of masks is definitely encouraged, or actually pretty much needed for healthcare professionals in their work settings. or use of aprons or use of gloves, which are constantly needed for healthcare providers. But even anyone who's using these protective gears, it is critically important that whether it's a C-store or any other professions or healthcare, these protective equipments, most of them that we use are one-time use. So we cannot just continue to use the same gloves or same mask over and over again.
Perfect. And I guess I'll add that once you get back home, if you're in one of those work environments where you have a good amount of exposure, then once you get home, I think just taking a quick shower, changing your clothes right away, or making sure that you have washed your hands thoroughly with soap and water, and you've done those things, I think it's a good idea to then decrease the risk of transmitting it to our other family members. Some of us may have seniors living with us at home, so those things
Absolutely.
can be done as well. We can go to the next question, please. And this question is again for you, Dr. Ojani, that what should I do if I'm exposed to someone with COVID-19?
So very, very critical question for especially those who may come across with people with a COVID-19. And one is considered exposed if you have been in contact with somebody you know has been tested positively for COVID-19. Or it could also happen if someone in your proximity and who's not well or has been sick and has coughed or sneezed without any cover. In this case, you are presumed to be exposed. Now, remember that just exposure or getting some virus particles on your hand does not necessarily cause a disease. In other words, everyone who's exposed does not necessarily cause the disease, because the virus causes disease through specific channels, as we heard Dr. Kharaj talk about it earlier, that it has to enter into the body through our nasal passages, through our nose, through our mouth, and things like that. So having said that, if you are exposed, and symptoms also may not appear because you may or may not have the condition, or if you have been exposed, it may not appear immediately. So the best thing for one person to do who's exposed is to go into what we call self-quarantine. Quarantine basically is a condition or situation in which a person is believed to have been exposed or have had a contact, but the person is not symptomatic as of yet. It is a way to do two things. Number one, to monitor if the symptoms appear or develop at a later point in time, and also to avoid possible spread to other community members or the family members. What this means that the person should stay home. They should minimize close contact with anyone or any people, including family members, and practice all the public health measures that we have just mentioned. We do the same thing when we get flu to avoid any spread, and we continue to do the same. In this case, when we are staying home for 14 days, it is important to keep observation for appearance of any symptoms. It is critical to know if the symptoms appear, because that may reflect infection and or disease. And if that happens, that requires immediate medical attention, and one should contact their primary care physician as soon as possible. Now, on the other hand, if the person does not develop any symptoms like fever or cough or difficulty in breathing within the 14 days they have quarantined after the exposure, then the person is not likely to have contracted the disease. So these 14 days quarantine is important to avoid infecting other people and spreading the infection within the community.
Okay, so if I had to summarize, if somebody is exposed to someone who's positive with COVID-19 infection, there are two things they need to do: 14 days of quarantine period and looking for symptoms. If they develop symptoms during those 14 days, then they need to call their primary care clinician to make an appointment and make sure that they themselves are not infected. Let's move on to the next question then. And this question is again uh, for Dr. Karaj, and this is: what should I do if I get COVID-19? What if a family member gets COVID-19 infection? What should we do as a family?
once you are diagnosed with that, depending on your symptoms, your primary care physician will guide you. Once you are diagnosed, isolate at home. Stay home during the whole illness. Restrict your activities outside your home except for getting medical care. Avoid public areas. Avoid public transportations like ride sharing or taxis. And if you are going to your physician and getting out, wear a mask. Wear a face mask when you're around other people, like if you're sharing a room or cars. The other guidance is not to take care of your pets. If you have pets and if you are diagnosed with COVID-19, ask your family members to take care of them. If you are visiting your doctor, call them ahead of time. If you are going for a follow up, if you're getting your symptoms worsened, when you call them, do let them know that you have been diagnosed with it or you have had exposure and now you're developing the symptoms. Again, the same principles hold true about covering your cough and sneezes. Avoid sharing personal household items. Do not share the dishes, drinking glasses, eating utensils. After using them, they should be washed thoroughly with soap and water. Clean your hands often. Clean all the high touch surfaces every day. All the counter, maybe a few times a day, like tabletops, doorknobs, the bathroom fixtures, keyboards, tablets, bedside tables. Everything that you have touched needs to be cleaned out. Monitor your symptoms. If you're getting worse, please do call your doctor. And before you do discontinue the home isolation, you do definitely need a clearance from your physician.
So I don't know if you mentioned Dr. Kiraj, but if it is possible, then the Jamati member who's positive should stay in a separate room and have their own separate bathroom if that is available. And of course, making sure that all these other things that you mentioned in terms of personal hygiene and making sure all the surfaces are cleaned should be practiced.
Yes,
So
absolutely. Stay in a separate room and away from other people at home if possible.
Perfect. Let's go to the next question then, and this is for Dr. Ajani, and this would be, what is the current status of COVID-19 infection in US?
So I have to say that the situation right now is pretty fluid. The numbers of persons infected in the US is increasing every day. Most experts agree that as the disease spreads, we expect more cases to develop. And those of us who have followed it over the news or looking on the website, we have seen the numbers really moving quickly. Not only that, the test, the diagnostic test or the lab tests, they are becoming more and more available, and that means more people will be tested, and so the number of diagnosed cases will increase because perhaps we are not finding out the less severe cases, which with the availability of tests we will find out more. Now, there are a number of reliable websites that continue to report current status. For example, the one that you see on your screen from Johns Hopkins site, they're reporting over 3,000 confirmed cases with 62 deaths. You may also find other websites. For example, CDC's websites reports about around 1,600 to 2,000 cases and spread of condition in 47 states. One needs to make sure you understand that some of the websites may or may not be updated daily, while others are updated on an hourly basis as well. As long as we understand that the numbers we are looking at, and these numbers, especially in pandemic situation, can rise very quickly in the second or later part of the epidemic. However, it becomes more and more important that we do everything possible to break this cycle of spread by implementing the public health intervention measures that we have just discussed.
Perfect. Let's move on to the next question, please. This is for Dr. Kiraj. Are there any travel restrictions to specific countries that are related to COVID-19 infection?
Yes, absolutely. So CDC has assigned travel restrictions of level 3 and level 2. Level 3 are those countries which has been totally recommended not to travel to, and those still are China, South Korea, Italy, and Iran. Japan is level 2, and there are also, as we know, travel restrictions and ban to UK and Ireland. And basically, any long distance travel, if you don't have to, the recommendation is to avoid that, though there are no bans on other travels.
So I think the next question would be that if one has traveled to any of these countries, uh, really, what should one do? And I'll ask Dr. Ajani to take this question.
So if you have traveled to countries with active transmission, for example, one may have traveled from Italy or returned from a cruise that has identified cases, in that situation, you are considered as an exposed person. This again does not mean that you have the disease, but the action needed will be the same as what we discussed earlier when people are exposed to COVID-19. And that means self quarantine for 14 days becomes necessary to avoid further spread of disease. Same as the contact, when during this 14 days of self quarantine, observations for appearance of symptoms is very critical to make sure that you have not gotten the disease, and in case of symptoms you reach out to your primary care immediately.
Perfect, like same, 14 days of observation and looking for symptoms. Uh,
Correct.
so on the same lines, this question also comes up. Let's go to the next slide. And the question is it okay to go on a cruise?
Cruise is another form of mass gathering where people are in a close quarters and with prolonged exposures. CDC currently recommends avoiding all cruise at this time or deferring it to a later point in time. This is important, especially important for people who are at higher risk, whether that's because of older age group or for chronic condition. So at this time, going to cruise is not recommended at all.
Okay. Now, of course, we can go to the next slide. As we all know, because of all these community measures, a lot of mass gatherings are canceled. Most of us are sitting at home, uh, not going out anywhere, no social gatherings. So, what do we do about physical activity? Can I continue to go to my gym, Dr. Ajani?
So gym, I would say, is also another place which is used by or shared by many people, and therefore a lot of common surfaces. In the interest of minimizing the spread or exposure, you may want to consider engaging in physical activity by different methods. One can engage at home. One can go out for a walk in the community or in the park, as long as the distance between the people is maintained at around 6 feet. Remember, not going to gym does not necessarily mean not exercising. Physical activity is an integral part of being healthy, but for the time being, if we can avoid gym and use other methods, as I mentioned earlier, that would be preferred.
And I believe it's extremely important at this time to remain physically active, not just for physical health, but also to maintain a good mental health, especially given so many social activities that are not happening right now. So let's go to the next question. And this question is for Dr. Kiraj. So if I am sick and I have these symptoms that you mentioned, Dr. Kiraj, do I see my primary care clinician, or should I just go to the emergency room? What should I do and how I should do that? Should I just show up or should I call? What should I do?
No, so the guidelines definitely is to call ahead before visiting your doctor. Call ahead, let your doctor or healthcare provider know, and tell them that you have or may have COVID-19. This will help the healthcare provider's office to take steps to keep other people from getting infected or exposed. And again, if your symptoms are really severe, you're having difficulty breathing, you may need to call 911, paramedics, or go to emergency room. Inform them beforehand, when you call, that these are your symptoms and you may have COVID-19 exposure or the disease.
Okay. And let's go to the next question then. And very quick response to this, Dr. Karaj, where can one get reliable information on COVID-19?
As we know, there are a lot of messages going around, but I would recommend, and as I had mentioned frequently, the go-to site is CDC. They have the reliable information. They are updating with everything that they are finding out about this disease. And if you do need any specific information about your county or your state, you can go to the public health websites on your state at your county. But please go to the reliable sources.
Okay. All right. And then let's go to the next question, which is what will Aga Khan Health Board do to keep the Jamaat well informed? Again, there have been a lot of announcements, a lot of advisories that have been sent out. We're doing quite a few of these webinars. We have sent specific advisories for our seniors, for kids in RAC, ECBC. We are monitoring the situation fairly closely. We'll continue to do so. In addition, the Aga Khan Health Board website, which we'll show in a couple of slides, has all the information that you'll need. It has content from CDC. In addition, it has some videos available. In the next day or so, we'll actually have some Q&As as well as informational material uploaded as well that our audience will find quite helpful. So let's go to the next slide then. And again, we would remind you all that we have another webinar that's coming up on Tuesday, March 17th at 8:30 p.m. Central. If you have any questions right now, you can write those down in the question box. Remember, the webinar for Tuesday is going to be in Urdu. So any of your friends or family who would like to attend that, it would be a great resource. So I'm going to start with questions, and I would request my panelists to give very quick responses to these questions. So this first one is for Dr. Ajani. Once you're cured or once you had an infection once with COVID-19, can you be reinfected?
A pretty important question, but again, at this point, we don't know yet. As recently as this morning, we have learned that people have become, they have tested positive after being recovered from one episode of COVID-19 infection. Now, does that mean they've got the disease again, or is the body is simply showing immune response? It is likely for a person to become positive, but we are not sure if that is necessarily reinfection. More information is needed, and more studies are being done on COVID-19 at this point.
I see. Okay, this next question is for Dr. Kiraj. Very quick question. If I need to go out for grocery shopping and run errands, should I wear a face mask?
You don't need to wear a face mask if you're not symptomatic or if you're not in the high risk category.
Perfect. So again, only folks who need to wear a face mask are those who are healthcare professionals in a healthcare setting, those who basically turn out to be positive and they're very close to their family members at home, or close contacts of somebody who has active infection. Outside of that, at this point, it is not recommended that everybody wears a face mask. The next question that we have is for Dr. Ajani. And Dr. Ajani, the question is, what is social distancing? Can you explain and give some very concrete examples?
Sure. So social distancing is used quite a bit for COVID infection prevention measures. It basically means remaining out of congregational setting or avoiding mass gathering altogether. And this is done by maintaining distance of about 6 feet from each other when possible. I do want to make sure we understand here that social distancing is not the same as social isolation, meaning it is important to stay away physically, but we still need to stay connected socially with our friends and family. That can be done via a number of technology, whether it's phone or Skype calls or internet, but it's important to stay connected socially with our friends and family, but do maintain social distancing, which can also be referred to as physical distancing, of maintaining distance of 6 feet and avoiding mass gathering of all kinds, whether it is going out for grocery, using public transportation, or going to any public places or places of worship, for example. So all of these are discouraged, but continue the social connection with the friends and family.
Perfect. That's great. There's a question that if the high-risk people are not going out, but their low-risk family members are going out, what can they do to protect their family members? And I think we partly answered that making sure that at workplace you practice good hand hygiene, cough hygiene, and once you return home, make sure that before you interact with those high-risk family members, you take a shower, change your clothes, and wash your hands thoroughly, and that will reduce the chances of your high-risk family members getting infected. Next question, Dr. Karaj, very quickly, you answered this to some extent. Are COVID-19 symptoms different from regular cold and flu?
Yes, the COVID-19 symptoms can be mild to severe, but in certain conditions with high risk individuals, it can be severe.
But they are very similar to regular flu, so one will not be able to differentiate COVID-19 and
no.
flu. Okay, perfect.
Yeah, the physicians may be able to, but your symptoms will be almost similar.
Dr. Jani, quick answer. How long can an asymptomatic person infect others?
The incubation period is expected to be anywhere between 2 to 14 days. So that's the time period when person can either show up symptoms or can continue to spread to others. And that is why as soon as one finds out that they are exposed or are a contact, they need to get into a quarantine situation so to avoid any further infection. Again, this is based on previous knowledge we've had, and more information about COVID-19 is coming out as we speak.
I see. Okay. So the next question that I would ask is, maybe this is for Dr. Karaj, at what point should someone get tested? Very quick answer. I think we've discussed this in a little bit.
Right. So if you have had a definite exposure and if you're symptomatic, call your physician, and there are guidelines to test. Not everybody is getting tested, especially if you're asymptomatic.
I see. Okay. The next question I have is for maybe Dr. Ajani can take that. How long does the pandemic generally last?
There is no particular formula in terms of how long does it last. It all depends on how interventions are applied and how successful we are in breaking the spread cycle. So I'm not sure we can identify a specific time period of how long the pandemic would last.
I see. The next question was that can you compare this pandemic to any other pandemic from the past?
There have been pandemic of flu. There was an H1N1 pandemic that happened, but again, this is a new virus, and we are learning everything new about this particular virus.
Okay. The next question, I think I can quickly answer that. Can I eat out at restaurants or order from restaurants? I believe at this point, it is extremely important that the reason we're doing social distancing measures is to allow to basically get away from mass gatherings. So as much as we can avoid, we should avoid going out to restaurants. The other thing is that especially for high risk segment that we talked about, those who are older adults with chronic diseases, those whose immune system is compromised, definitely not recommended that they go out to restaurants or malls or grocery stores. Doctor, maybe I'll ask this question to Dr. Kiraj. Is it safe to buy meats, poultry, fish, and vegetables from grocery stores? Is there a risk of transmission from these sources?
No, not that we know of.
Okay. Dr. Ajani, this question, it's a tough one, but I'll ask you. And we have a few questions, and I know the data is pretty weak on this. How long does the virus survive on various surfaces? Asked by very many people. I know it's controversial, but what is the best advice you can give?
So at this point, we know that there's very variable from few hours to perhaps even a day or so. But again, we don't know for sure. We do know that it lasts much longer on surfaces like glass and metal, and much shorter on fabric or cardboard stuff. But there is no fully agreed upon or fully known time period that the virus would last on surfaces.
I see. Okay. And I guess there was some clarification on the last question about buying meats or fruits and vegetables. It's fine. We do not think that those are very major sources of transmission of infection. Dr. Ajani, can you clarify that answer a little bit?
So basically, when we're talking about meats and vegetables, there is no evidence, or not that we know of, that it spreads through the food itself. It's more about the logistics of going out in the public places and how we get it. That becomes more of a question, but it does not transmit through meat per se, or food items per se.
Okay. Uh, Dr. Dr. Kiraj, question for you about, we have a few questions related to pregnancy. What do we know about pregnancy and COVID-19 infection?
So, depending on the previous studies with SARS, so far we do not currently know if pregnant women have greater chance of getting sick from the COVID-19 than general public, nor whether they are more likely to have serious illness as a pregnant. So basically, but pregnant women do experience changes in their bodies which may increase their risk of some infections. But with these viruses, we don't have definite information yet, but when they do get sick, they do get severe illnesses. So it's important to protect themselves by the same principles that we mentioned about washing your hands, staying away from sick people.
Okay. And is there any advice on breastfeeding if you have COVID-19 infection?
So again, it has not been found to date that it is passed in the breast milk. You can still feed your baby, but if you have the infection, make sure you wear a mask and wash your hands before you hold the baby. Or the other thing is, if you want to pump the breast milk and have someone else feed the baby, that is also doable.
Okay, that's helpful. So Dr. Ajani, I asked you this question about children. Lots of questions about how does it affect children, and what are some of the things that people need to know about children and COVID-19 infection?
So in terms of children, if you're talking about those below age 2, they have not developed their immune system fully, so there may be some increased risk. But when we talk about young youth, or young adults, they somehow do not appear to be at increased risk. They are on the average risk as other population, but not at an increased risk. And therefore, it is critically important for them also to maintain the prevention steps that we have talked about.
I see. I do want to say there was one question about children with asthma or congenital heart disease. Those definitely we should keep an eye on, because especially those with congenital heart disease or moderate to severe asthma would be counted as a high risk condition. So those we should definitely keep an eye on. I think there's one question about people who are taking immunosuppressant medications for arthritis or colitis, colon infections. In those cases, those people would be considered high risk. So it's important for them to definitely stay away from crowds and keep a very close eye on hand hygiene as well as cough hygiene, and decreasing their sick contacts. I'll ask Raj a question here, and we are having a lot of questions about whether people should keep their doctor's appointments. Can you say a few words about that, Dr. Kiraj?
So there has been new development on that. If you have a regular physical and if you think you don't have any active or acute conditions that you need to see your physicians, we are recommending to delay that. But if you have an active problem that you need to check with your doctor if they can help you out over the phone appointment.
I see. Okay, I'll ask this question to Dr. Ajani. What is the current status in terms of vaccines for this virus in US?
So vaccine development is going on, and in fact, a number of clinical trials have also started as of last week. But again, as you know, the clinical trials do take some time. So it's in development, it's not available yet, and it may take some time before it becomes available for public.
I see. Next question is for Dr. Kiraj. Dr. Kiraj, very quick question, quick answer. Do zinc lozenges or Ayurvedic treatment, do they work for this? Do we have any evidence?
Not really.
Okay. The next question is for Dr. Ajani. Dr. Ajani, can you provide some recommendations on travel within US? Is it okay to travel on a plane?
So again, at this point, all non-essential travel is being discouraged because when you get into the plane, you are still getting into it's a logistics, and we know as of this morning there are lots of logistical issues, which also puts you in an enclosed closed area. So although if you have to travel, you can find ways to get it done properly. But in general, if it is just travel for the sake of it or for vacations, at this point, it is discouraged to get into air travel.
And I'll ask you, since you're an epidemiologist with quite a bit of background in this, we have a few questions related to, do we know how long this will last? Do we know whether this will improve in summer months? What can you say about that, Dr. Ajani?
So again, as I've said earlier, that this is a new virus. We are still learning a lot. There were lots of expectation that there might be some seasonal changes, but as you know, globally, infection has been seen in all situations, in all weathers, like in Southern Hemisphere as well. So at this point, we don't know for sure how it'll react. And again, stopping the spread will be the best option to curtail this spread within the community.
Well, I really thank you both for excellent answers to all the questions we had, as well as responding to most, if not all, questions that we had from our attendees. At this point, what I would ask all of you is that if you can just have one take-home message for our attendees today. So maybe we'll start out with Dr. Kiraj. Dr. Kiraj, do you have one message for our attendees that they can take away with this webinar?
Stay calm, wash your hands, and avoid public places or congregations.
Perfect. And Dr. Ajani, for you?
I would say prevention is better than cure, and we all need to take full steps to prevent this condition and spread of this infection.
Perfect. And I will end by saying that this virus depends on humans to survive. If we as humans break the chain by doing all these things that we're doing right now with proper hygiene, proper cough etiquette, some of these social distancing measures, this virus will not be able to survive. We will hopefully be able to break this cycle. And again, the reason for doing these webinars is to give out information. And remember, the model we have is PNP: prepare, not panic. Prepare, not panic. With that, I thank you all for attending today's webinar. As I said earlier, we have a webinar on Tuesday, which will be predominantly in Urdu. So those of your family members and friends who would like to attend that webinar, please let them know. And thank you and have a great rest of the day.